Can we begin with how many COVID-19 patients are currently in the ICU?
Well, good morning to you and all the viewers and listeners. As of today, we have 11,610 cases across Guyana. These are active cases. And of those, we have 133 persons in hospital, with 88 of those persons at the Ocean View Hospital, and 11 of them in the ICU. Over the last 24 hours, we would have recorded 119 new cases. This number came down from what it was a couple days ago. And what we have noticed is that there have been a downward trend over the last 2 weeks or so. So our positivity rate has been falling. That means the amount of tests that is being done and the amount of persons coming back positive, that has been falling. So it shows that we are getting less cases.
Minister, questions on the Infectious Diseases Hospital. Have the oxygen pipelines been fully installed throughout the main areas which required it?
So as you know, we had a project last year where we were installing oxygen pipeline to every bed in the hospital. We have about 195 beds at the Ocean View Hospital, and most of them now would have their individualized oxygen. So that project has been completed, and patients who go there can get oxygen off the wall outlet. When you compare that with previously what was there, where we had to put in oxygen tanks at the bedside, this has certainly been a great improvement. So we have enhanced the range of services that we can offer at the facility. So for example, if a patient needs dialysis, we can offer dialysis at the Ocean View facility. If a patient needs emergency surgery, we have an operational theater, a surgical theater at Ocean View where we can do emergency surgeries. If a patient needs emergency cesarean section, we can do that at the Ocean View facility. And of course, with all the other underlying illnesses, we have the capability of treating patients there. So it functions as a hospital, but it is a specialized hospital dealing primarily with COVID-19 patients and whatever underlying issues they might have. So right now we have 423,439 persons who would have received a first dose of their vaccine. These are adults. That would mean that about 82.5% of our adult population would have received a COVID-19 vaccine. We also have 312,874 persons who would have received a second dose of a COVID-19 vaccine. That's about 61% of our adult population. In terms of children 12 to 17, we have given 32,580 doses as first dose. That's about 44.7% of that age cohort. And we have also administered 22,971 as second dose. That's about 31.5% of that age cohort. We have also given out 38,916 booster doses. 5 to 6 months, the antibodies in your system starts to wean, meaning that it gets lower, and therefore your capacity to fight the COVID-19 disease would drop. So you need to get boosted, and that's why we are encouraging people to get the booster shot. And from these numbers, as you can see, we still have a number of persons who need to come out and get their first dose, whether they're adults or children between 12 to 17, they still need to get their first dose. And there are also room for improvement in the second dose vaccination.
Minister, thank you for joining us today for this COVID-19 update.
Well, thank you very much.